Hi, I'm Gabrielle Juliano-Villani. I'm a licensed clinical social worker, and let's go over EFT tapping for anxiety relief. EFT tapping, often just called tapping or the emotional freedom technique, is a five-step technique that targets acupressure points to reduce pain and intensity of mental health symptoms. People with anxiety, phobias, depression, trauma, and pain disorders can benefit from tapping. It can be integrated into any mental health treatment and taught to individuals so that they can do it on their own. By gently tapping on 9 meridian points while focusing on the pain that you want to address, you are able to restore your body's energy and bring it into balance. Tapping is a 5-step technique that uses a specific setup and pattern. It's easy to learn and can be done anywhere, anytime. So before I go into any more detail, I've linked to our in-depth article on EFT tapping and some resources for getting treatment in the description below. Also, help us promote quality, reliable mental health content by subscribing to Choosing Therapy, liking and commenting on this video, and sharing us on social media. So now let's talk about how EFT tapping works. Tapping utilizes elements of cognitive, exposure, and somatic therapies. In the first 2 steps of the process, you are engaging the frontal lobe of your brain as you do through traditional talk therapy. As you begin to tap, it stimulates the meridian points, subsets of the points targeted in acupuncture. When activated, such as by tapping, they send a signal to the brain to relax. Tapping seems to target the amygdala, a part of the midbrain that has a key role in the body's response to stress, as well as in processing fear and intense emotions. Tapping the meridian points while repeating a reminder phrase causes a decrease in the stress hormone cortisol. High levels of cortisol have been linked to numerous physical health conditions, including reduced immune function, cardiovascular disease, and stroke. It's also been linked to mental health conditions such as anxiety, depression, and post-traumatic stress disorder, which is PTSD. So by reducing cortisol levels, it is possible to increase both physical and mental health and reduce symptom intensity and frequency. There are 9 meridian points targeted in the tapping sequence. Regardless of the issue being addressed, the points and the sequence remain the same. The 9 EFT tapping points are the side of your hand. So this is the outer edge of your hand below your pinky. The eyebrow point, the inner points of your eyebrows just above the bridge of your nose, the side of your eye, the bone along the outside point of your eye, under eye, the bone directly under your eyes, under your nose, right above the center of your upper lip, the chin point, the crease below your bottom lip and above your chin, the collarbone point, 1 inch to the side of where your collarbones meet. It's kind of hard to see with this shirt that I'm wearing. The underarm, the area on your rib cage about 4 inches below your armpit, and the top of your head, which is the crown of your head here. EFT tapping follows a sequence of 5 steps, often called a round, that takes about 2 minutes to complete. Lower intensity issues may only require 4 or 5 rounds to provide relief, while more intense issues may take 10 to 12 rounds. Intense or chronic issues are best addressed through consistent tapping over time. The benefits are cumulative, meaning you will get the best results by tapping every single day. Here are the 5 steps of EFT tapping. First, identify the issue and the emotion that you would like to focus on. Then identify the emotion that underlies it. For example, if you're dealing with chronic pain from rheumatoid arthritis, you might feel helpless, exhausted, or angry. If you're dealing with a depressive disorder, you might feel hopeless, worthless, or numb. Now, rate the intensity on a scale from 0 to 10. With 0 being no intensity at all and 10 being the most extreme. So rate the intensity of the emotion that you're focusing on right now. Next, create the setup statement. The setup statement begins with even though, followed by 2 parts. Part 1 is the issue you're focusing on, and part 2 is a phrase of acceptance. Examples of part 1 would be, even though I feel anxious about this presentation, even though I feel depressed, or even though I feel heartbroken that my partner broke up with me. And examples of the part 2 statement are, I deeply and completely accept myself, I honor my feelings, I am safe right now, or I allow my body to relax. So here's an example of the full setup statement. Even though I feel extremely anxious right now, I deeply and completely accept myself. Even though I feel pain in my joints, I allow myself to relax. Even though I feel afraid about flying on an airplane, I honor my feelings. Now, for step 4, you'll tap while repeating the full setup phrase. You take a nice deep breath and then let your breath return to normal. Begin tapping on point 1 on the side of the hand, and you can use either hand. Tap lightly with a pressure similar to drumming your fingers on a desk. Repeat the full setup statement 3 times. Then begin tapping on point 2, which is the eyebrow. Repeat part 1 of the setup statement or some variation. So for example, if part 1 of your setup statement was, I feel extremely anxious right now, you might say extremely anxious, anxiety, or feeling anxious. Continue tapping along points 3 through 9 while repeating part 1 or a variation on your setup phrase. For points 2 through 6, you might want to use 2 fingers. And now rate the intensity again. Take another deep breath and rate the intensity of the emotion you're focusing on. It's normal not to feel any significant change after only 1 round of tapping. So continue repeating steps 1 through 5 until the intensity of the emotion or the issue you're focusing on has reduced to a 2 or 3. For more details, I've linked to our in-depth article on EFT tapping in the comments below. Now let's talk about how EFT actually works. In one study comparing EFT to cognitive behavioral therapy, which is CBT, 90% of those who received EFT had a significant improvement in symptoms compared to 63% of those who received CBT. Additionally, tapping was effective without any changes from medication. It only took 3 sessions for results as compared to 15 for CBT. Other studies have found tapping to be effective in treating anxiety in a number of populations, including adolescents, students, healthcare workers, and a variety of adults. The reduction of anxiety symptoms is maintained after treatment, with one study finding participants still experiencing reduced symptoms 3 months later. The emotional freedom technique has many benefits. It can be done for free in the comfort of your own home at a time and a place convenient for you. And since it's easily learned, you can easily practice it whenever you feel emotionally triggered. Other advantages of EFT tapping include that it's self-guided, it's natural, there's no side effects, there's no cost, it can produce results very quickly, and it's painless. If you want to find a therapist who facilitates EFT tapping, you can use an online therapist directory to search for someone who's able to provide this training. Many therapists who note that they use somatic or energetic techniques are often able to facilitate tapping as well. While insurance companies don't often denote providers who offer tapping, other healthcare professionals such as primary care doctors, naturopaths, and psychiatrists may also be able to give you a referral. Keep in mind, licensed therapists are able to offer tapping as long as they've had basic training. While there are certifications offered through several EFT institutions, they are typically obtained by non-mental health professionals. Certified tapping practitioners can provide EFT, however, they can't provide therapy. Tapping is a non-invasive, easy-to-learn technique that can be done anywhere and can help you start feeling better quickly. If you're dealing with anxiety, depression, PTSD, chronic pain, or stress, consider tapping. If you're already working with a mental health professional, ask if you can integrate this into your treatment plan. And I've linked to a few resources below to help you find a therapist or explore other tools.